Hello and welcome back to Vibrant Despite Cancer, your channel, your series of video about improving our quality of life, our energy level as we undergo cancer treatments. This is your channel, and I hope that you have had so far a pleasant and constructive week. Today, I would like to talk about something a little bit different about the myths that surround cancer and cancer treatment. And I would like to debunk some of those myths. And this is for patients or families or caregivers or anyone who knows somebody undergoing cancer treatment. Misinformation about cancer is everywhere, sometimes in well meaning advice from friends, in forwarded messages, in confident sounding articles online. Some of it is harmless, some of it can cause some real worry or guilt, or even sometimes lead to someone delaying treatment or restrict treatment unnecessarily. These myths mostly exist because there is a core, a kernel of truth, of something real underneath the misunderstanding. So, one of the myths, of course, is that sugar feeds cancer, so you must eliminate sugars entirely. In my case, for example, I have totally eliminated added refined sugar, processed sugar in my diet. It is true that cancer cells use glucose, sugar, for energy, but so do every other cells in our body, including healthy cells, the one that our body depend on mostly during treatment. This myth, I found out, comes from the misunderstanding of PET scans, which use a glucose tracer that cancer cells absorb in large amounts because they are more metabolically active. We will get it. Not because sugar causes cancer. So what is worth paying attention is very high intake of added refined sugar, sugary drink are linked to weight gain, to excess weight associated with increased risk of several cancers. So moderating added sugar, refined sugar is reasonable generally as a general health habit, not simply something that is purely anti-cancer. Another interesting myth is that alternative natural remedies are safer than conventional treatments. Herbal remedies or alternative diets can be seen as effectively useful as real cancer treatments. So far, it appears that no herbal product or alternative therapy has truly been shown to fully cure cancer. Some approaches, acupuncture, massage, sound treatment, mind body practices, can absolutely and genuinely help with treatment side effects and quality of life. During my 38 weeks of radiation, I had the pleasure of undergoing some of those every week: acupuncture, healing, massage, sound therapy, and I am convinced that it helped in a big way. The most important and practical point: always tell your care team about anything you are taking, including vitamins and supplements that might seem harmless, but they need to have the full picture. Another myth that really surprised me: you cannot or should not exercise during treatment. My body needs to rest completely, and physical activity is too risky. Well, for most people, supervised, scaled physical activity is not only safe, but critical, important, beneficial, and associated with reduced fatigue, better mood, better tolerance of side effects. And major cancer organizations now actively recommend staying active. And as you have seen in the previous videos, I myself go run or hike every day. I go to the gym about 5 or 6 times a week, and it truly makes a huge difference. Another interesting myth is that cancer is contagious, that being close to or hugging or sharing space with someone who has cancer is a risk. Cancer itself cannot be caught through contact, sharing meals, or being close to someone. The only scenario where cancers have moved between people is in very rare cases involving organ or tissue transplant. The risk is so infinitely small, and but overall, your presence, your physical closeness are safe and valuable. And this is really, on the contrary, cancer patients need closeness of friends and family members. Another myth that a lot of cancer centers talk about is family history means you are likely to get cancer as well. Cancer runs in my family, so it's almost inevitable that I will get cancer. Statistics seem to show that only 5 to 10% of cancers are caused by inherited genetic mutations. Most cancers result from a combination of factors that accumulate over a lifetime. Most of them do not really necessarily have direct link with inheritance. Having relatives with cancer can be worth discussing with a doctor, but it's not a sentence. Another myth that we hear a lot, and that we cancer patients are quite worried, I was worried about it, is that surgeries or biopsies can cause cancer to spread. If I have a biopsy, if I expose the tumor to air, cutting into it will cause the cancer to spread. When I had my biopsies, I had 12 biopsies of my tumor, I was thinking about it. This is one of the most persistent fears, but actually it is not supported by evidence. Surgeons follow careful, established procedures specifically designed to prevent any spread during biopsies or tumor removal, using separate instruments for different areas of the body. The risk of surgeries causing cancer is, again, super low. Perhaps another myth that we can gently debunk is that all cancers are the same and they must be treated the same way. Cancer is the same disease with the same treatment regardless of where it is. So cancer is not one disease, but a large family of disease, each of them with different biology, behavior, and treatment approaches. Today, they have cancer centers, oncologists have so-called precision treatments. They look at the DNA of your tumor and they design cures or treatments that are specific to your cancer. Even within the same organ, cancers can be very different from one patient to the next. And this is why cancer research is so complex. My oncologist was telling me a few weeks ago that there are so many new researches and innovations and developments. She was making the comparison with a fire hose of knowledge coming all the time. So these are some of the myths that I wanted to gently debunk today. Almost every myth on this list comes from somewhere reasonable: a half-remembered scan results, a frightening story passed along by someone who means very well, a wish to find something within our control. That instinct to look for and control an explanation during frightening experience is human, it's not foolish, and the most reliable compass is usually a simple one. When something you have heard sounds dramatic, absolute, or too neat, it's worth asking your care team about it directly. So this is general information, not medical advice, and of course, always discuss specific concerns with your medical team. So until next time, remember that you are like a candle. You can light up many more candles without losing any of your brightness. And until next time, I wish you health and happiness.